Clinical Conversations on today's Smart Chiropractor show. Clinical Conversations is our segment where we, not surprisingly, get clinical. We've been highlighting a variety of our awesome speakers from Axis 2021, which was our online clinical event. Today is going to be no exception, but I want to plant that bug and say keep your eyes and ears peeled in the coming weeks and months as we announce not only the date, but the lineup for Axis 2022. But looking back to 2021, we have been showcasing 10-minute snippets of the really great presenters, topics, and presentations that we were fortunate to have at Axis 2021. And as I said, today's going to be no exception. We have a all-time great, Dr. Gerry Clum. He presented on spontaneous intracranial hypotension. I looked down because I wanted to make sure I get that medical term correct. And it was a fantastic presentation. This is an area he has spent a lot of time, effort, and energy understanding at a level higher than anybody I have seen or heard. And we wanted to share some of that presentation with you today. So we're going to pick it up as Gerry and Dr. Clum was heading into the causation aspects of this. And I think you're going to get a lot of fantastic information that you can apply in your practice. So without further ado, let's head over to Dr. Clum's presentation from Axis 2021.
The lack of controls is another feature that is important relative to causation establishment. So relative to location, to the leaks by location, the most common location for dural leaks to develop is the cervical thoracic junction. The second most common leak is the thoracolumbar junction. And obviously you understand better than most people that those are transition points for forces in the spine and for strains in the cerebrospinal fluid circulation as it passes from the cranial vault through the foramen magnum down to the filum terminale and the anchoring in the lower portions of the spine and the coccyx. Now, another complicating feature associated with these problems is that among patients who have spontaneous leaks, not those that were produced by a lumbar puncture, but spontaneous, between 30 and 40% of those patients will be leaking from more than one location. So this becomes a generalized problem, and it's a lot of shooting in the dark for surgeons who are attempting to repair these problems. And we'll talk about that in just a little bit as well. So let's talk about imaging associated with this type of problem. The most sensitive study for detecting cerebrospinal fluid leaks is a CT myelogram, and a CT myelogram of the full spine. The problem with CT myelography, particularly full spine CT myelography, is that it involves a good bit of radiation. The amount of radiation is between 15 and 50 millisieverts associated with a full spine CT myelogram. And that has been expressed to have a potential risk factor of between 1 in 500 and 1 in 2,000 patients that level of radiation would be enough to induce a cancer of some type. The second problem with CT myelograms is that CT myelograms are themselves invasive, and they require the injection of dye within the dural sac. So the very problem that we're trying to address, someone's trying to address, such as a dural leak, is going to be induced by injecting into the dural sac again in the process of this study. So while CT myelography is the most sensitive, it may not be the most appropriate or the most viable. In contrast, MRI of the brain is a no radiation, brain and spinal full spine is a no radiation environment and is a non-puncture environment, obviously without contrast. So when we begin this process of evaluation, most centers that evaluate these types of problems begin with an MRI of the brain and MRI of the spine as well. Some will do that with and without contrast. Some will do one or the other. And the things that they'll be looking for in that process are subdural fluid collections, venous engorgement, pachymeningeal enhancement, pituitary hyperemia, and then the sagging of the brain, the Chiari-like look to the brain. Again, that sagging is produced by the diminished CSF and the diminished buoyancy of the brain and the lowering of the cerebellar tonsils into or toward the foramen magnum. So how often do these things occur? Well, There's a couple of studies we can look at. One in 1995 that came out of Olmsted County, Minnesota, that suggested that the incidence of these problems was about 1 per 50,000 persons. In 2007, a study was published that said the incidence was more like 1 in 20,000 persons. And we know that the phenomenon occurs more commonly in females than in males at a ratio of about 2 to 1. The average age of onset is between 38 and 42 years of age, but the condition has been reported in young children as well as in elderly. And there is no ethnic predominance for this condition in any particular group or subgroup. So what are the clinical signs that would be associated with dural leaks? Well, first and foremost, that we've already talked about several times, is the classic positional postural headache. This is the kind of headache that the patient, when they get up in the morning, is no problem. They're up for a few minutes, perhaps an hour. They start getting this drawing, pulling headache obviously in the head, and it's very quickly resolved with recumbency and laying down. And you can appreciate the fact that if we have had a leak and with less buoyancy, that laying down restores that, requires less pressure to cause fluid to circulate back up, and the floating level of the brain increases. But in addition to the classic sign of the postural headache associated with dural leaks, these patients may also express with nausea, vomiting, neck pain, facial numbness, diplopia, changes in hearing, photophobia, visual blurring, upper limb pain or paresthesias, dysgeusia, isolated cranial nerve involvement, and a flattening of the basis pontus. Now, obviously, I'm not aware of any patient that's had all of these problems. Like many conditions, a few of these, one of these, two of these may be signs for you to keep in mind. When you have a patient with postural headache and you have any of these types of signs associated with it, it should obviously cause your antenna to go up very quickly and quite dramatically. But we want to keep these in mind. And if you think about these types of patients, these are a lot of these symptoms are symptoms you'll see in a post whiplash associated disorder. They're the kinds of symptoms you might be associated with a vertebral artery dissection, an area that I've worked in the past and have been continue to be quite involved in. So there are areas that we want to be careful about, and we want to be alert to along the way. They could be things that our care would be absolutely appropriate for, no questions asked. And they could, in contrast, be things that might be in the best to be in the hands of a surgeon. And that's our job to help sort that out. Now, I said earlier that connective tissue disorders were a possible indicator of, or a possible associated problem that would lead to dural leaks. And some of the connective tissue disorders that we can look at will be very well defined, like an Ehlers-Danlos syndrome or a Marfan syndrome. But others won't be so well defined, and there may just be an odd or isolated collagen disorder or connective tissue activity that we wouldn't necessarily think to be associated with a dural leak. Now I'm talking about things like early cataracts, retinal detachment, the development of scoliosis, a high arched palate, markedly flexible joints, typical of Marfan's, as we said before, markedly flexible skin, typical of Ehlers-Danlos, unusual scars, unusually long fingers, again associated with Marfan's, history of a collapsed lung, a spontaneous collapsed lung in the patient or in a family member, an unusually tall stature, tall, thin stature, again, the Marfan's type presentation associated in that individual or seen in that individual or in their family. And then unusual heart valves, such as mitral valve problems, a history of vascular anomalies, such as aneurysm, dilated or tortuous blood vessels, or dissection. So all of these types of symptoms and these types of conditions, we wouldn't necessarily associate these or think dural leaks when we hear about a patient with these. But we begin to combine together the postural headache. We begin to combine together some of the symptoms of nausea and vomiting that we talked about, or paresthesias and so on, with these types of connective tissue disorders that are delineated on this slide. we begin to see this starting to form into a picture that becomes more readily identifiable as you bring more information to the table. So let's get to the specifics about dural leaks and chiropractic care. The first reference to chiropractic care and spontaneous intracranial hypertension appeared in 2000 in a report of a series of 30 patients. One of these patients had received chiropractic care at some unspecified point along the way during their care. And there was no suggestion by the author, no suggestion of causation, simply a reference to the fact that one patient had, quote, a history of chiropractic manipulation, while others in this study had a history of golf, exercise, swimming, or cough. Again, the author did not say chiropractic care caused this. It just simply observed that the patient had one patient in 30 had this problem. In 2001, a year later, an author by the name of Jarrett reported on a 35-year-old man with post-whiplash associated disorder. So the patient had a situation that in and of itself, the whiplash disorder, could have produced the dural leak.
All right, that was a look back at Axis 2021. Dr. Gerry Clum presenting a fantastic presentation on spontaneous intracranial hypotension. He talked a lot about dural leaks right there. That could be something that causes that dramatic decrease or that hypotension. I saw it most prevalent when I was in multidisciplinary practice. We'd see it post-surgically. If the surgeon happened to nick the cord, you can get a dural leak that way. Thankfully, most of the time, it just ends up with a really bad headache for a few days. But there were occasions where they'd have to go back in and use some form of glue and non-ideally even put a stitch or two there. So the good news is, I think from a chiropractic perspective, we rarely see these types of things, and we really have nothing to do with causation. However, it's important to stay up to date. So if a patient comes into your practice and something just doesn't seem right, it's great to have that knowledge base to be able to dig into and really help identify who they should see, where they should go, so they can get their best care possible and that they can live their best life. And that is, all about really being able to identify, sort through, triage, and understand what's going on with those patients. So you don't need to be an expert in every single thing, but having that bit of information like we bring to you during Axis is a great way to stay up to date on the clinical topics. And nobody better than Dr. Clum to present that topic, Jason.
Dr. Clum's amazing. It's great that we're able to have such an expert share really the secrets of the body, the secrets of how the body works and what it looks like when it's not functioning the way it's supposed to. That is very much part of being a great chiropractor, is not just being a great communicator, which is important, not just being a great adjuster, which is very important, but really understanding how the body works, the secrets of the body, what it means when it's working well, what it means when it's not working to its potential or has some sort of trauma and damage. It's always great to learn from Dr. Clum, and I am also super excited for Axis 2022. It's great to keep sharpening our skills to understand the miracle of how amazing the body is. It is something we should have reverence for, and when we see topics like this, things happen. And the more we understand what those things are and how they work and how they're supposed to work, better chiropractors we're going to be. So great choice. And as always, thank you, Dr. Clum, for your service.
Thank you so much for watching this video on the Smart Chiropractor. To not miss a single thing that's clinically oriented, marketing oriented, or more, be sure to subscribe to our YouTube channel today.